This is Stockport Birth Centre and Stepping Hill Hospital. This is one of the birthing rooms.
I'm Debbie and this is Stephen and this is Ruby, who's 6 days old. And we're sat here because 6 days ago we were in this room having Ruby.
This birth centre is for healthy low-risk women who could be having a baby at home.
I was given the option of a home birth, but with it being my first child I wanted to be at a hospital, but in this environment it felt like a home birth really.
If there's a problem during labour, the woman actually transfers to delivery suite and is seen by a doctor there. What we've done here is removed any visible equipment that would remind you that you're in a hospital.
I didn't feel like I was in hospital.
It's because there's no equipment and there's no hospital paraphernalia.
We have the equipment available obviously, but it's not actually in the room. We've tried to bring some colour in here, got a pool in the room as well. We've looked at the lighting, you can have music playing in here. And the aim is to create an environment that's as calm and peaceful as possible. We're really looking to a growth in birth centres, an increase in the home birth rate, because that Maternity Matters says very clearly that women should have the choice of home birth or delivering in a midwife-led birth centre. The evidence is really clear that labouring in a birth centre environment or at home increases your chance of having a normal birth.
It worked, didn't it?
It worked.
It was fantastic, really good.
We're standing outside the house of a lady called Josie, who is now coming to the end of her life.
Recently in Solihull we've started working in a more proactive way, giving people positive choices about where they want to die. Josie's decided she wants to die at home, and as Macmillan and district nurses we're doing everything we can to support that.
I chose I wanted to be here. Talked it with the children and said I'd like to die at home.
We knew Mum wanted to be at home, and no one questioned that. It was just seen that was the natural thing to do.
I'm the district nurse and this is Sue, the Macmillan nurse. We liaise very closely, regularly about patients.
Macmillan nurses are palliative care specialist nurses, so we have an overview about patients' care and symptom control. And the district nurses and the GPs are the main carers and have the day-to-day care and control of the patient.
It gives me a lot of support working closely with the Macmillan team and with the GPs. We all liaise closely together and I think it gives the best for the patient.
Mum's got cancer and she isn't well, but there's not a huge amount of medical things that she needs. But it's just quite reassuring that a district nurse comes in once a week just to check that things over, as well as the Macmillan nurse who comes in. They spend a bit of time with us afterwards just checking that we're coping with things and we're all right.
I can't fault anybody. I honestly can't fault anybody. In fact, they've done more than I would expect them to.
It's just very good joined up working, and it's got to benefit the patients and the relatives because they're the ones left behind.